Thank you very much for the invitation and the opportunity to speak to you all today. And thanks to Robin for those fantastic cases. They will come up actually in a way that I didn't expect in one of the later slides. So my objective today is just to let people know about a relatively new resource that's been added to the mix in Wisconsin for managing patients with opioid use disorder, and particularly for helping get patients access to harm reduction services, and looking forward to expanding sites of care. And that is our work center, Wisconsin Opioid Overdose Response Center at the School of Pharmacy, which I now co-direct with Jay Ford. And really my objective is to help you understand, what our goals and activities are at this center. Think about ways in which pharmacies and pharmacist partners can be resources for you and your practice to support opioid treatment and overdose prevention activities. And importantly, help you take a look at our website, get you to it to get another resource for clinician and patient-facing resources for Wisconsin residents. So what is WORK? So WORK is the hub for a network of community pharmacies that are deployed across the state. And our mission is to support that network to deploy evidence-based interventions to reduce the number of overdoses in Wisconsin. And our broader vision is really thinking again about pharmacy as a partner for communities, particularly those in areas of the state where they may be more, remote from other types of care, to be empowered to work with their communities for happier, healthier outcomes, especially for really sensitive and pressing healthcare outcomes, certainly opioid overdose being one of them. So what are we doing with work, and what's our reasoning for why you should think about pharmacy as a partner? So I think one of the statistics that really drives us is right there in the middle, that 90% of the population in Wisconsin and in the United States live within 5 miles of a pharmacy. So often this is the most accessible healthcare resource to an individual, as I mentioned, especially for folks who are living outside of major metropolitan areas. And the areas that work is focusing in on are enhancing patient and drug safety, providing tools for overdose prevention and reversal, expanding access to medications for opioid use disorder, and then developing biologics for screening and treatment. So those urine drug screens, the foundational technology behind them are antibodies that detect these small molecules. And as we heard, they can be imperfect, right? They're looking for a general shape of something. So a wolf looks a lot like a dog, and without confirmatory testing, you might mistake a wolf for a dog. So we're very interested in advancing that technology as well to find things that are hard to find, but also stop us from finding things that aren't appropriate. But on the patient and drug safety side, several of the initiatives that we've been working on through work are the first is developing educational pamphlets with patient-friendly terminology that have been vetted by community members across the state on things like naloxone and fentanyl risk. So how do we use naloxone in an opioid emergency, and how does that change if fentanyl is involved, if at all? What are options for disposing medications that are available? How does one use something like injectable naloxone, or naltrexone? Apologies for the typo. And what are medications for opioid use disorder, and when are they helpful? So we have these pamphlets that are available. They're printed, they're in PDF form. In a couple of slides, you'll see a link to where you can go to get them. We've deployed them across our network of pharmacies. One of our efforts this year was to translate them into whatever languages our pharmacy partners told us were useful for their population. So we started with Spanish and Hmong and English. Those are available for almost all of these, but select ones are also available in languages like Arabic, Ukrainian, Somali, and several others. So we're very excited about having those as persistent resources for people to use to help patient understanding. And we're excited, we just launched this less than a year ago, and the pharmacy resource network that's deploying these and several of the other things you're going to see is now standing at 76 pharmacies. If you're interested in getting those brochures or looking at those pharmacies, this might be the most important slide in the whole presentation because it will direct you to our website. So the QR code there will take you to woorc.pharmacy.wisc.edu. And I have a screenshot of our main page there. So the focus areas, there's information for community members, there's harm reduction information for healthcare professionals. And then we have a map that will allow you to locate pharmacies across Wisconsin that are in our network that are providing either free harm reduction resources, these patient education pamphlets, acting as sites for long-acting injectables, or some combination of the above. We also have a useful map by the state region that will identify not a comprehensive list, we don't think. If you want to be listed on there and we're missing you, please let us know. But clinics, treatment centers, community organizations that people can be referred to. So if we look at the couple other portions of the website, the clinician resources, there's information about opioids. There are clinical tool links for things like mHealth options that he'll talk about next time, community of practice information, and then things like condition-specific patient education. So please take a look at that. There's a find help link for people where each of the regional care options are available. So if you have a patient who's being referred, often pharmacies don't know the entire scope of people in their region that might be working in the behavioral health space. I think it's an area of little overlap in our healthcare system that there certainly could be better, right? The behavioral health folks working with the pharmacists. So that's useful for us, but also, of course, for patients who are looking for care. I mentioned the pamphlets. So these are free. These are printable. They're educational tools. You can see test strip instructions for fentanyl and xylazine test strips in several languages, and the others I mentioned as well. So in addition to the education, we're providing overdose prevention and reversal tools. So there are fentanyl and xylazine test strips available through these pharmacies, as well as mailbag envelopes for destruction and free Narcan. We've been working with not only community pharmacies, but also veteran-facing and low-income serving pharmacy clinics. I see one of our partners here on the call today. We're excited to be delivering materials to stock their clinic and especially their vending machine. So those resources are on the map as well. We've been working with DHS and with PSW to continue to try and expand and use all the different pathways to access naloxone. So pharmacists are able to, of course, fill a prescription for them, provide them through the Wisconsin standing order. It's now OTC, and we also have free handouts, and work is providing this naloxone for free. Another of our objectives is to try and expand pharmacies as an alternative site of care for medications for opioid use disorder, and especially for the increasing number of long-acting injectable options that we have in this space. So pharmacists in the state do have authority to administer non-vaccine injectables, provided that they've taken an appropriate training course on this. All of our recent grads from the University of Wisconsin School of Pharmacy and our other schools of pharmacies of the state will have this, but many pharmacists who graduated not as recently won't. So we are providing free access to that training so people can be able to provide these injections. And we're also developing a network of pharmacist-led peer educators to expand education on buprenorphine prescribing changes, particularly in regions of the state where we're seeing, less access and uptake to that life-saving medication. Another notable piece on this, thinking about the ways in which practice can evolve, is that pharmacists now have provider status just as of a couple years ago. And in addition to being able to, provide the injection pharmacists can now actually bill for reimbursement for services that are within the scope of their license that would otherwise be performed by another Medicaid provider. So this provides, I think, an important incentive for pharmacies to get involved as alternative sites of care where there may not be a clinic-based injection site that's nearby, and I think represents a huge opportunity for expansion of telehealth as well as medication provision in areas of the state where we'd like to see more of that happening. So Vivitrol, Sublocade, Brixadi certainly would be reimbursable, and there's definitely collaborative practice agreements opportunity for that with prescribing, medication management, and even things like drug screening. On the buprenorphine detailing side, we're working on establishing these networks of local providers, making sure that there are reliable medication sources for patients when they do get a prescription, conversations to enhance the confidence of providers who may not have been doing this previously. With the removal of the X waiver and the low barrier to entry for DEA prescribers, we're hoping to have more clinicians who are not specialists in addiction medicine feel comfortable talking with their pharmacy partners to understand how these drugs work and how we can get them to our patients. And then the last thing that we're working on, as was mentioned, my lab works on developing new screening tools. So we've developed antibodies against morphine-like, fentanyl-like, and nitazene-like compounds. We have been assessing them for recognition of novel opioid-like structures that are emerging, not quite as quickly here in Wisconsin, but certainly other areas of the country, and looking at blockade of measurement of opioid-induced behaviors in preclinical models, thinking about antibodies not only as screening tools, but also as potentially therapeutic tools of the future to mitigate the consequences of overdose. So we're excited to see some positive results on that front, and we'll be continuing to work there. So overall, I hope that you got a sense of what it is that we're doing at the Wisconsin Opioid Overdose Response Center. So between patient education, harm reduction tools, enhancement of pharmacy as a partner in opioid use disorder, not only dispensing, but also administration, and then development of these biological tools. We're excited to be one of very few opioid-focused centers in a school of pharmacy across the country. And we really want to help community pharmacies feel that they are partners and partners at the forefront of solving opioid overdose, delivering those harm reduction supplies, leveraging the deep expertise pharmacists have in knowledge of drugs and how they work to enhance access and develop those next generation tools. So thank you to those of you who are on the call who've already worked with us. If you haven't, please do take a look at our website, and we're thrilled to be trying to hook people up with pharmacies in their area, ones we know who have already sort of raised their hand and said, yeah, we want to be part of the solution. So thank you very much.